1.2 Blockchain for e-prescribing. Secure data exchange. Blockchain technology offers a decentralized and secure method of storing and sharing patient data. In the context of e-prescribing, blockchain can be used to ensure that prescription data is tamper-proof, encrypted, and securely transmitted between providers, pharmacies, and other healthcare entities. This enhances the security and privacy of e-prescriptions, addressing concerns related to data breaches and fraud. Transparency and traceability. Blockchain's immutable ledger provides a transparent and auditable trail of prescription activity. This could help reduce prescription fraud and abuse by allowing providers, patients, and regulatory authorities to track the origin, dispensing, and changes made to prescriptions in real time. 1.3 Next-generation software and interoperability, seamless integration. Across systems, future e-prescribing solutions will increasingly focus on seamless integration with broader healthcare ecosystems. Next-gen software will allow e-prescribing platforms to communicate effortlessly with other health systems, such as EHRS, laboratory systems, and health insurance networks. This interoperability will ensure that providers have access to comprehensive patient data and can make well-informed decisions. Advanced user interfaces. E-prescribing platforms will likely evolve to include more user-friendly, intuitive interfaces that streamline workflows for healthcare providers. With easy access to prescription data, decision support, and communication tools, providers will be able to manage prescriptions more efficiently, reducing errors and improving overall care. 2. Expanding e-prescribing for telemedicine and remote care. 2.1 Integration of e-prescribing with telehealth. Remote access to prescriptions. As telemedicine continues to grow, the integration of e-prescribing with remote care platforms will be essential. E-prescribing allows healthcare providers to prescribe medications to patients during virtual consultations, ensuring that even those who cannot visit a clinic in person can still receive the prescriptions they need. This is particularly important for managing chronic conditions and providing timely care during emergencies. Cross-platform compatibility. The ability for telemedicine platforms to integrate with e-prescribing systems will allow patients to receive prescriptions that can be filled immediately, regardless of where they are located. This improves access to medications for patients who live in rural or underserved areas, and it offers a more convenient experience for patients who prefer virtual consultations. 2.2 Addressing the rise of chronic disease management. Continuous monitoring and medication adjustments. E-prescribing will play a critical role in managing chronic diseases, such as diabetes or hypertension, via telemedicine. Providers can remotely monitor patients' health data, e.g., via wearable devices, and adjust medications accordingly. E-prescribing systems integrated with remote monitoring tools can automatically suggest medication changes based on real-time patient data, ensuring that prescriptions remain appropriate as patient needs evolve. Telehealth support for mental health. Telemedicine is rapidly becoming a primary tool for mental health care, and e-prescribing will be central to ensuring that patients have continuous access to medications for conditions such as depression, anxiety, and other psychiatric disorders. The ability to prescribe and adjust psychiatric medications remotely through e-prescribing will reduce treatment gaps and improve access to mental health services. 2.3 Regulatory and security challenges, ensuring compliance. As e-prescribing expands in telemedicine, it will be critical to address regulatory and compliance challenges related to remote prescribing, especially for controlled substances. Regulatory bodies like the DEA will need to establish clear guidelines for telemedicine prescriptions and ensure that e-prescribing systems support secure and compliant prescribing practices, particularly for opioids and other high-risk medications. 3. The global adoption of e-prescribing and its future impact on healthcare. 3.1. Expanding access to healthcare. Global integration of e-prescribing. While e-prescribing is already widely adopted in countries like the US and parts of Europe, its adoption is still growing in many low- and middle-income countries. As global healthcare infrastructure improves, the integration of e-prescribing systems will play a pivotal role in ensuring that prescriptions are accurate, accessible, and securely transmitted. In regions with limited access to healthcare professionals, e-prescribing can also facilitate telemedicine consultations, ensuring that patients receive timely prescriptions. Improving medication adherence. The global expansion of e-prescribing could help improve medication adherence worldwide. Patients in both developed and developing countries will benefit from easier access to medications, better tracking of prescriptions, and fewer medication errors. Additionally, by integrating e-prescribing with mobile health apps, patients can receive reminders, dosage instructions, and other important medication-related information, further enhancing adherence and reducing the risk of complications. 3.2. Standardization and global interoperability. Global standards for e-prescribing. As e-prescribing becomes more widespread, the development of global standards for electronic prescriptions will be necessary to ensure compatibility between different healthcare systems. Standardized formats for e-prescriptions will enable cross-border prescribing and medication management, which is particularly important for patients who travel internationally or for expatriates receiving care in different countries. Interoperable systems. Ensuring interoperability between e-prescribing systems across regions and countries will be a critical challenge, but it will lead to significant benefits, such as reduced medication errors, improved patient outcomes, and streamlined administrative workflows. This will require collaboration between health organizations, governments, and technology providers to ensure that systems can effectively communicate and share information. 3.3. Improved healthcare outcomes, reducing medication errors. Globally, e-prescribing's ability to reduce errors in the prescribing process can have a profound global impact on healthcare quality. By eliminating issues such as illegible handwriting, transcription errors, and lost prescriptions, e-prescribing can reduce medication errors that lead to adverse events or hospitalizations. This will be especially impactful in countries with high rates of medication errors and where healthcare systems are overburdened. Cost reduction. The widespread adoption of e-prescribing could lead to substantial cost savings in healthcare, including reductions in administrative costs, fewer hospital readmissions due to medication errors, and better use of healthcare resources. The elimination of paper prescriptions and the automation of various processes will free up valuable resources and reduce the financial burden on healthcare systems globally.